Bismillahirrahmanirrahim. In the name of Allah, the most beneficial and the most merciful. Today we will talk about liquor. Fetal liquor plays a very important role in ultrasound. We will talk about liquor, that how to assess and how to measure the liquor on ultrasound. There are 4 pockets of liquor in that image. Always remember, whenever you look the liquor, there should not be any fetal part. If there is any fetal part, it means liquor is not accurate. Means you did wrong measurement. Now I will discuss what is polyhydramnios and what is oligohydramnios. Remember that normal liquor is 5 to 25 centimeter, but if liquor is less than 5 centimeter, it's mean oligohydramnios. And if liquor is more than 25 centimeter, it's mean liquor is polyhydramnios. Means liquor is increased more than normal. And in oligohydramnios, it means liquor is less than normal. See, polyhydramnios. Whenever patient is presented to you, always perform the ultrasound and then look at the liquor. If there is an increased liquor more than 25 centimeter, maybe the patient is diabetic mother, because diabetic mellitus is a major cause of polyhydramnios. And whenever you perform ultrasound, carefully do the scan, because there is a 60% chances of anomalous baby. It may in polyhydramnios, jejunal atresia, esophageal atresia, any sinus abnormalities, anomalous baby, you will see on the scan, not 100% but 60% you will see. So be careful in polyhydramnios. In polyhydramnios, always check the fetal abdominal for duodenal atresia, esophageal atresia, jejunal atresia, and always check the fetal head for encephalocele and hydrocephalus, encephalocele, and many other CNS abnormalities. Now I will tell you what is oligohydramnios. It's wherein liquor less than 5 centimeter is called oligohydramnios. Oligohydramnios is dangerous, but polyhydramnios is also dangerous. But oligohydramnios is more dangerous than polyhydramnios, because in polyhydramnios baby can survive, and in oligohydramnios, if liquor is reduced, you can manage it conservatively. But if liquor is totally absent, you have to perform C-section. It's depend upon condition. What is oligohydramnios and polyhydramnios both are diagnosed on ultrasound. You will look polyhydramnios and polyhydramnios, always measure the pockets of liquor, 4 pockets of liquor. If less than 5 centimeter, then oligohydramnios. Due to the intrauterine growth restriction and posterior urethral wall diseases which is related to the fetal kidney and demise and preterm rupture of premature rupture of membrane, these all factors causes the oligohydramnios. Whenever the patient is presented to you with a history of PROM, means premature rupture of membrane, or first of all perform the ultrasound and see the condition of liquor, that liquor is absent or liquor is reduced. If the liquor is reduced, manage it conservatively. But if the liquor is totally absent, perform C-section. Whether the weeks will 25, 26, 27 or 30. But remember, if weeks are 34 or less than 34 centimeter, apply a batnesol or drawn injection, because it causes the maturation of lungs, and then you will perform the C-section, because batnesol or decadron, they are very essential for maturation of lungs. Now please carefully see this picture. Normal amniotic fluid and oligohydramnios. In normal amniotic fluid, as you can see, the blackish part which is amniotic fluid, it's normal. If you will measure, it is normal. But in oligohydramnios, see the liquor, it is very small liquor, which means its liquor is reduced. Carefully look at this picture. Now look at this picture. There are 4 pockets. In first pocket, second pocket, third pocket, and fourth pocket. In these all pockets, liquor is good. It is a very good liquor. Liquor is adequate. Again, remember, normal liquor is 5 to 25 centimeter. During measurement of liquor, there should not be any fetal part. Again, look at this picture carefully. 1, 2, 3, 4. There are 4 pockets. The blackish part is a liquor, and measure it carefully. Normal is 5 to 25 centimeter. Amniotic fluid is basically it is an important part of pregnancy and fetal development, and the normal amount may vary, but generally women carry about 500 milliliter of amniotic fluid. During pregnancy, amniotic fluid plays a very important role. It maintains the temperature, fluid distance the amniotic sac, and thereby allows the free movement and growth of fetus. It prevents the adhesion between fetal parts and amniotic sac, and it permits the fetal swallowing, which is very essential for GIT development. Amniotic fluid is a very important factor in development of pregnancy. Please never ignore this. Please always remember one thing. Normal amniotic fluid increases in amount throughout the pregnancy until it reaches its maximum level or at 38 weeks. But amniotic fluid decreases 38 weeks onward. Remember, at 38 weeks, amniotic fluid normally increases throughout the pregnancy, but after 38 weeks, it will decrease. Thank you. Jazakallah. Please subscribe my channel so you can watch more videos. Thank you. Allah Hafiz.